When Mandy assigned me the topic, I kind of thought to myself, well, the most important aspect of factors affecting fertility associated with the uterus is probably uterine fluid. Uterine fluid's pretty difficult to talk about because we've got just lots and lots of data slides, and I don't want to flood you with data slides because I don't think it's very interesting. Now, I'm not sure yet. Do you know, Mandy, what we're doing with the information, the slides? Yeah, so they'll be sent the PDFs, is that the plan, emailed? Okay, well, so there's PDFs of the talks where we've put the slides on. So I made sure that if you like to read, that you can read for hours and hours about uterine fluid. There's lots of information. We won't talk very much about that. What I wanted to talk to you about, Dixon has touched on. Dixon and I are good friends, and we sat together for the last week and a bit more because we're on the committee, and we never did exactly discuss what each other was going to talk about. But I think it's important that we understand what happens when a mare's bred. It doesn't matter whether she's bred by AI or whether she's bred by natural service. When a stallion ejaculates, he puts a certain amount of semen in the mare. And anyone like to, well, Dixon's kind of mentioned it, so I won't ask a lot of questions. So let's say the stallion's breeding frequently and it's the third mare he's bred for the day. He's probably going to put 2 or 3 billion sperm in the uterus. And then Dixon said to you before, I don't think perhaps without giving a number, it goes on, doesn't it? It just kind of keeps on going. Without giving you a number, about 10,000 sperm get into the oviduct. So I guess my first question is, what's happened to the rest of the sperm? You know, it's a bit of a waste, isn't it? And only one sperm then is able to fertilise. So what happens is the mare has a massive reaction in the uterus, and a girl in Finland, Turtu Katila, showed using scintigraphy that as soon as the semen goes into the uterus, it reacts like you've got cats fighting in a bag, and the contractions of the uterus eliminate most of the sperm. And that occurs relatively rapidly. And within 4 hours, some work at Texas A&M showed very clearly that within 4 hours, the sperm in a normal mare gets into the oviduct. And you can put whatever you like in the mare's uterus after 4 hours. If you put it in before 4 hours and it hurts the sperm, you may not have a normal fertile cycle. But if you're prepared to wait 4 hours, or you're even 6 in a mare that may not be totally normal, then the sperm should be safely inside the uterus. Inside the oviduct, which is the site of fertilisation. So we started with, let's say, 2.5 billion sperm. We have this massive reaction of contractile reaction of the uterus. We get a flood of neutrophils, which are kind of cells associated with pus, that go into the uterus and eat the sperm that are left over that didn't get pushed out physically. And within 12 hours, a normal mare is pretty much back to normal, whereas a problem mare will continue on and maintain fluid that typically would get worse. Sometimes it's because she's infected, sometimes it's just because she can't clear it. But, I should talk to you just briefly. Dixon didn't really mention this, but these factors all affect the number of sperm that are either produced. So the size of the horse's testicle is very important, as is the age of the horse. The maximum size of a horse's testes is about 13 years of age in a thoroughbred, and the maximum number of sperm that's produced is typically associated with the longer daylight. So at June 22nd, the summer solstice here, we'd expect approximately 30% more sperm than compared to the winter solstice. That's the major, in fact, sometimes it's even a little bit more than that. That's the major difference between summer versus winter production. Ejaculation frequency doesn't interfere with production of sperm, but is very important when it's related to how much sperm is put into a mare by natural service. So if you have a horse that's got a total scrotal width of 85 millimetres, for example, which is okay, but it's small, and it's in the summer, and he's breeding 3 mares a day, he may not have enough sperm to put in the uterus to give you maximum fertility. So just to give you some figures, it's interesting that AI has been very important to us thoroughbred people. You know, I cast myself as a thoroughbred person because I do so much vet work on thoroughbred farms and I breed thoroughbred horses. AI has been very helpful to us to know things that have been then of benefit to the thoroughbred breeder. So AI taught us that we need, for maximum fertility, to put 500 million progressively motile sperm into a dose. If we say a stallion averages 50% progressive sperm, then every billion sperm that we put into the uterus will have 500 million progressive sperm. So if you've got a stallion that's got marginal testis of about 85 millimeters in the total cross-section, he's probably not going to give you more than 3 billion total sperm per day. So as Dixon showed you before, by the time you get to the end of the day, you probably don't have enough sperm. In fact, a lot of times you don't have enough sperm. So if you've got a horse with small testicles and you're using natural service, then you should probably try to limit him and not breed 3 or 4 times per day. Try to select the mares as well as you can. So what happens to the semen when it goes in the uterus? Here you can see the semen. It's got to get into here. And I just thought you'd probably like to, see. No, really, it's annoying. I've gone too far. I held the button down, sorry. Probably like to see what the uterus looks like. So on the left, we have the inside of the mare's uterus, and we're driving up the horn. It's a little bit too light in here to see this as well as I'd like. And so the sperm makes its way up here, not by swimming so much, more by contraction of the uterus, spreading it evenly around. And this little button here, right there, which you can see here, which in a minute that'll move, but that little button here is called the Uterotubule junction, and that's where the sperm go to. And inside there's a reservoir where they sit reasonably happily and away from toxic effects in the uterus. So if we're trying to breed a mare for maximum fertility, we have to make sure that the semen has a good opportunity to get into the oviduct. And the best way to do that is to make sure there's no fluid in the mare's uterus, make sure there's no infection. Then fertilization occurs and the embryo develops in the oviduct. And so we can treat the mare from 6 hours after breeding. We can treat the mare for a few more days. When the mare ovulates, we can still put antibiotics or whatever treatments that we think are important into the uterus for at least 2 more days. So we might have 4 or 5 days from breeding that we could actually go ahead and treat the mare to improve fertility, because the embryo develops in the oviduct for 6 days. So embryo transfer has been very helpful in determining those timelines for us. We've been the beneficiaries of that research that's given us the opportunity to know the numbers to put in there, how long it takes to get in there, when to start treating, when to stop treating, when the embryo comes out. We've been very fortunate. The other thing is that I think that most people feel that there's not much selection process, that the sperm is put in there and a random sperm is selected to breed. But in fact, that's not true. There's some quite interesting selection processes that occur early on. And the first one and I'm just going to very briefly mention it because I think it's interesting. This is the semen as it goes in. So you can see that we've got morphological abnormalities. So the sperm, these are normal sperm here. So you've got a head, a mid-piece, and a tail. And you can see that there's an abnormal, it's called a cytoplasmic droplet there. Have a bent tail, have unusual shaped heads. And yet here on the right is white blood cells or neutrophils eating the sperm that are left behind in the uterus. And these sperm here are from the oviduct. And they're beautiful sperm, aren't they? And the oviduct has this ability to select the most morphologically normal sperm available for fertilization. And that's the process of fertilization, binding to the zona pellucida on the outside of the egg. And then there's an acrosome reaction that helps get involved, get the sperm inside the egg, and then there's decondensation of the male genetics to bind then with the female genetics that the egg is. Righto, so these are some of the things that we're going to talk about, and we have extensive slides on in the presentations, but I'm actually going to skip most of the fluid stuff and just make one little comment about an area that I think has been of great interest to all of us over the years, over the more recent years, and that is biofilm. Biofilm forms with bacterial infection of the uterus, and certain bacteria are able to coat themselves and their local environment with biofilm, which stops the antibacterial agents destroying the bacteria. And it's very important that it's very important that you understand that certain bacteria produce that and then won't be able to be destroyed by the antibiotics. So here on the left is a biopsy, and we will talk maybe a little bit more about biopsy, but you can see that it's quite a nice looking uterine surface that's been fixed in formalin. Here's the same biopsy, or another piece taken from the same uterus, and you can see a layer of biofilm with a lot of white blood cells. So I think for many years we used to use formalin, and I think, Sid, you've been using Booins all your life, haven't you? Yeah. So for those of you that don't know, Sidney Ricketts is a force in the equine reproductive world like none other, and he's produced a lot of world firsts, and he certainly was very important in our understanding of biopsies. Anyway, so this has really helped us identify horses with biofilm. I'll just give you an idea about how important the biofilm is. If we have Pseudomonas that doesn't produce biofilm, the concentration of antibiotics necessary to destroy it is 2, and if the Pseudomonas is producing biofilm, you can see we need 8 times the concentration. So a lot of our standard treatments don't work. And you could see here the growth of bacteria in a dish when there are no biofilm, that these certain antibiotics don't actually destroy the bacteria. So this is the control. This is ceftiofur, a common intrauterine antibiotic. In fact, I think Sid reported on the use of ceftiofur very, very early on. And then here is a combination agent. So the point I'm trying to show you here is that if you look, there's an antibiotic and there's an agent that we like to use for biofilm, but neither of them independently work. But when you add them together, they work very well. And so you may have noticed a change in the treatment of mares over the years, and a thing that we pioneered early on is hydrogen peroxide, which may sound a bit unusual to you, but 1% hydrogen peroxide added to an antibiotic preparation in the uterus, if there's biofilm there, works exceptionally well. It doesn't always work. In fact, sometimes the Tris EDTA doesn't work very well. This one doesn't work very well, and we have to use another agent. But and here's an example of where acetylcysteine and ceftiofur didn't work at all. You've got a lot of bacterial growth. What time are we due to switch? Do you want me to get back on time, or?
8 to 9 minutes.
Yeah, righto. Thank you. I just want you to know, Lee, you took 10 minutes from me. So we'll talk first quickly about urine. Urine in a mare's uterus is quite an interesting thing. It interferes with fertility by hurting the sperm. And here's an ultrasound, a rectal ultrasound, where you can see the cervix and you can see urine in the vagina, and this is urine in the bladder. And so sometimes the urine is from the mare because when she urinates, it doesn't get passed properly, but a lot of times it might be associated with the stallion. And here's a collection of semen, and you can see that it's very, very yellow. And it's interesting to see because it's one of the management techniques. In the thoroughbred, we don't have the ability to have the ability to get different parts of the ejaculate and breed the mare as you would with AI, but understanding when the urine comes is helpful. So here's the beginning of ejaculation. So the stallion's breeding an artificial vagina, and you can see the beginning of ejaculation here. There's the sperm-rich fraction, which he's meant to be catching. He's a bit far away. And he's pretty much missed it, as you can see. But so we want that because there's no urine in it. And then he gets into place in about the time the urine comes. So he does catch the urine, which is not much help. But I guess what it shows you is that the urine comes late in ejaculation. It's not like when the stallion ejaculates, it's just mixed with the urine. So you can manage an ejaculate by fractionating it into separate things. But in the thoroughbred world, we have to do something different, because this is what happens here. This is urine crystals. That's what happens when you get the urine. It dehydrates the sperm and it stops it moving. So typically and here's just a video showing you the urine after a mare's had the stallion ejaculate urine into her. And the way we manage it in a thoroughbred program is typically to teach the horse to urinate properly before he breeds. And it's amazing, the stallion is so easily trained because the reward of ejaculation is so positive to him. And once he realises that, and it probably only takes, most times it would probably take us 4 or 5 days maximum to teach the horse to void properly, not just to mark. Start by taking him to another stall, then teach him to void properly. And you'd be surprised, within a very short period of time, whenever you catch him to take him to breed, you put him in another box, and he knows that as soon as he gets to urinate, he's going to go to the shed. And it's a very, very good way of managing them, because some of them can't be managed any other way. Next condition I wanted to talk on is uterine cysts. Uterine cysts are an annoyance because they can interfere with our ability to see a pregnancy. So here you've got a lot of cysts, and there's a tiny little pregnancy here. In fact, there'll be a video of that in a second. And here we have a mare with quite a lot of uterine cysts, and I guess the question is there a pregnancy there? Can you see a pregnancy amongst those cysts? And it doesn't matter whether there is or isn't. The point is that it can be really hard to identify. But the other thing is that cysts are associated with mare age, and to some extent the degree of fibrosis in the mare's uterus. So you have a mare with a lot of cysts, well, she's old and she's got changes in her uterus. And so here's a pregnancy, and there's a cyst, right, not here yet, there it is. There's a cyst that's impinging on the pregnancy, and most of the cysts actually form at the corpus corneal junction, at the junction of the horn and the body, and that's where the fetus likes to develop. So they can impede the motility of the fetus. Probably not very often that happens, but they can, and they can interfere with the ability of the placenta to form adequately at the area of the corpus corneal junction, the junction of the horn and the body. And you can, here we're using colour flow Doppler to see the heartbeat right here, see the heartbeat of the foal, because I mean, you look at that, it's hard to understand whether there is or isn't a pregnancy there. So because it can cause problems, we tend to take them out. And I think I'll skip that one. Yeah, and show you here's what a cyst might look like and here inside the mare's uterus. And it's the same mare. We're looking at the cyst on the ultrasound versus looking at it with an endoscope. So there's a variety of different techniques that have been established over the years to remove the cysts. To be honest, I only try to remove big cysts, and mostly of the time I prefer just to very crudely rip them off the mare's surface with my fingers, as long as you can get your hand through the cervix. But some mares you can't. So you can. This is the junction of the horn and the body here. You can see the cysts like that area. Pat McHugh described a technique. In fact, he gave me a couple of slides a few days ago of cutting the cyst off with a snare, making a snare out of some pipettes and cutting it off. It's a very elaborate treatment for something that I don't think really needs it. Cysts this big, sure, I would take them out. I wouldn't bother about cysts like that. And then something we've done a little bit of more recently, particularly for those cysts that have got a broad base, that are not hanging by a pedicle, is to use the laser. And so it just basically burns the cyst, and the burning makes it contract. There is a weakness to the way I treat them by ripping them off the surface. The weakness is that they can grow back. They grow back, I think, less often when you burn them with the laser therapy. You can see that it's already considerably smaller, and you can even just see it kind of contracting as the lasers applied to it. I think I'll skip that. Foreign bodies in the uterus. There's a variety of foreign bodies that we see. It's, sometimes we'll scan a mare and we've not had any history that she had a marble in there. And here's a mare that this mare's coming back into heat. She's been bred. This is from Colorado. She's pregnant. She's about a 16-day pregnancy, and that thing here, that halo you can see there. I'll wait till it comes back. There. No, it's stopped now. Anyway, that was a marble. I might just make that play one more time. Oh, there, good. You can see that was a marble, and that's the pregnancy. So the marble in this case it's typically put into the uterus to stop the mare cycling. If you want my opinion on that, I wouldn't bother doing it personally. If you're serious about stopping a mare cycling, using oxytocin in the diestrus period for a number of days, normally starting about day 5 or 7 and going for at least 7 days, is enough to stop prostaglandin release, and the majority of mares will not cycle again. The problem is that you've got to inject them twice a day, but the reward is it works way better and more consistently than the marble. And here's a video just showing you what the marble looks like in the uterus. We can remove foreign bodies from the mare's uterus. The most common foreign body we come across would be the tip of a uterine swab. Unfortunately, they break off sometimes, and they can be challenging to get out, particularly in maiden mares. And you can see here a swab on the surface of the mare's uterus, and sometimes you're lucky you can get your finger in through the cervix and hook it out, but sometimes we might have to go in and grab it with a pair of forceps with the endoscope and pull it out. Unfortunately, it's not uncommon to have a swab break when you're taking routine samples. Some things that you can't see with ultrasound. Every year I get to go up to the Hunter Valley and look at problem breeders, and I don't really promote the work because it's very time consuming, but it's a necessity, and so I might look at 10 mares a day. And one thing I've learned, and we tell the interns this all the time, if you don't look, you won't find. Simple as that. And so this is one area where it's really important. So if you're doing a reproductive exam, it's typically not something that you would think about using an endoscope to look around the uterus, but have a look here. Here's the scan of this mare. You can see she's coming into heat, which is what we wanted. She's got some fluid. She's got folding, but there's no sign. There was a cyst there, but there's no sign of these adhesions. And these adhesions are going to stop the mare's uterus opening properly and stop placentation. And her history was getting in foal and aborting. Now, if we hadn't have bothered to look with the endoscope, we wouldn't have seen it. So the message is really must look. And here's another one. This was a very interesting one. She'd been 3 years barren, and so here's the ultrasound on the left, and there's the ovary, part of the horn, there's corpus luteum, and then there's a bit of fluid that's confined to the one horn and a bit of fluid in the other horn, but there's nothing in the body. So we went in with the endoscope, and you can see here you've got very, very fine adhesions, and you've got fluid on the other side. So that's the uterine horn, other side of the adhesion. See the adhesions there? And it's just, the sperm won't get through that. And even if it did, the egg's not going to get out. So that's the reason that this mare had been barren. Presumably that's the reason this mare's been barren for 3 years. So you take a biopsy and then go ahead and hopefully have a better successful outcome. Just finishing up with a couple of conditions. Air is really an important one. And, I'm sure you all look at the ultrasound when the veterinarian's scanning. So everybody is part of it. That's the good thing about ultrasonography, is that it's all very inclusive for everybody. Air is recognised by the white dots that you see here. Typically sometimes there'll be shadowing. See how there's shadowing underneath it like that? And that, if you see that, then the mare needs a caslick. And if the caslick's in place, then she probably needs a perineal body repair or something different, because you shouldn't have air in the mare's uterus at any time. The only one exception in the thoroughbred world would be if you've performed a treatment, maybe that day. It typically shouldn't be there the next day, but if you performed the treatment, it might still be there that day. And so when you see air, you must look very carefully at the seals against infection. So this mare is a young mare, and she has got, this is the vulva, the vaginal lips here and vulva. This is called the vestibular sphincter, and she has not opened it when her lips are parted, but here this mare's got a weak seal, a weak vestibular sphincter, and she might need more than a caslick. She might need a perineal body repair. But if you see air, then there's something wrong. Other unusual things we see is cancer in the uterus, like a leiomyoma. Sometimes they're pedunculated, or other times they might be like that, actually part of the wall of the mare's uterus. So here's a bigger one. They don't tend to cause a lot of problem unless they're this big. And when they get this big, so here you can see this is about 8 centimetres, and we've put a bit of fluid around it. That's a bit of saline. The white is just air bubbles in it, trying to highlight it. Pyometra. Horses' uteruses that fill with pus are difficult to treat. So here's a uterus just full of pus. It's a post-mortem specimen. It's not a surgery. I mean, people have taken the mare's uteruses out to help fix that as a problem. But they don't tend to do anything except discharge pus, and sometimes they don't even do that. They don't get sick. You'd think with a gallon or more of pus in their uterus that they'd be sick, but they don't tend to be sick. Dixon Varner told me yesterday, or two days ago, about a friend of his that has been cutting part of the cervix open, because the problem with mares with pyometra is that they typically have damage to the cervix. Sometimes it's vaginal adhesions, like this mare. You can see she's gallons of pus is coming out. But mostly it's cervix damage. And so by cutting a wedge out of the cervix, you actually stop the cervix closing properly, and it's the cervix closing that keeps the infection in there. Now, that's not going to be a very good treatment for fertility, but a lot of pyometra mares are not going to go and foal anyway. So it's not a bad way to manage them in the long term if you want to keep them alive. I think I'll just skip that. I reckon we've gone long enough. There's only a couple more slides, and it's in the presentations. Right, well, thank you for your attention. We're going to have no questions, are we?
Thank you very much, Angus.